So this is part 3 of the anatomy of the heart and lungs, focusing now on the internal structure of the heart. Here, we'll be dealing with the chambers of the heart. And to understand the concept of chambers, we talk about separators, we talk about valves. So we will go through the different chambers in a physiologic manner in terms of where the blood enters first until the part where the blood exits the heart. So everything begins in the right atrium. So this is the chamber that will receive all the deoxygenated blood coming in from the systemic circulation from the major veins. So as you can see, the one coming from the top is the superior vena cava, and the one coming from below is the inferior vena cava. So if you cut open the right atrium and look at its walls, you would see that there would be different orifices. So when we say orifice, it means an entry point or a hole where blood can enter or exit depending on the direction of flow. So one opening is that of the superior vena cava, which I mentioned earlier, drains blood from the venous blood from the upper half of the body. And then you have the inferior vena cava, which brings back venous blood, the oxygenated blood from the lower body. And then, not forgetting that the heart itself needs nourishment and needs to bring back its own wastes and have its own blood oxygenated in the lungs. Thus, the third orifice there would be the coronary sinus, which is the entry point of the coronary vein. The other orifice is that which exits the right atrium and goes into the next chamber, which is the right ventricle. So that orifice is called an atrioventricular orifice on the right side. So the right atrioventricular orifice, the exit point of the blood which is pumped into the right ventricle. So looking at the orifice, so it must be guarded by a gate. So in terms of fluid dynamics, we talk about valves, which keeps the blood in or out of the chamber. And it opens and closes as needed. So you can see for that atrioventricular orifice on the right side, it is guarded by 3 valves, which have 3 cusps. That's why it's called the tricuspid valve. So now, looking at the walls of that right atrium, so the part which just drains blood from the rest of the body doesn't need to do much work except just expand. Thus, it is a smooth portion, whereas the rest of the right atrium needs to pump the blood into the right ventricle. So the separator between that smooth portion and the rough muscular portion is the crista terminalis or the sulcus terminalis. So it depends on where you're looking at the right atrium, from the outside or from the inside, where you will see that crest. We will show you this later. So there will be a vestige of the past where there was once a hole in the wall of the right atrium. It now becomes just a depression or a fossa in the right atrial wall adjoining the left atrium. So that is called the fossa ovalis, where the foramen ovale used to be. And then the pouch of the right atrium looks like an ear, thus it's called the right auricular appendage. So to explain why that upper portion of the right atrium is smooth, this is actually a fetal major vein which has been incorporated into the wall of the right atrium. So that's the sinus venosus, a major uh, venous vessel, a major vein during fetal development. So this is the sinus venosus, part of which will, so you're looking at it inverted. So since it's a vein actually, so that sinus venosus and the future right atrium will fuse to form the right atrium that we see anatomically in the cadaver. Now, the part of the right atrium which has a lot of muscles because it needs to squeeze and pump the blood into the next chamber looks quite rough on the inside. So it has a lot of muscular ridges. So it's called the musculi pectinati or the pectinate muscles uh, over there in the wall of the rough portion of the right atrium. So the separation from the what used to be the sinus venosus, the smooth portion, and that rough portion of the right atrium is the crista terminalis or a crest, the terminal crest of what used to be the sinus venosus. So it's a crest on the inside and look like a depression on the outside of the right atrium. So other leftovers from the past that may be seen is a fossa ovalis, but sometimes in some people and in some cadavers, they may have had that hole which failed to close. So it's called a foramen, a patent foramen ovale, meaning it stayed open when it should have closed on childbirth. And then another separator, which I'll be discussing later, the remains of the septum sagundum. So these are the walls between the left and the right side. So a remainder of the past, which is opened in the fetus but closes in the adults, is the limbus. So the limbus is also a term for rim. So there is shown by the red arrow pointing at number 4. When the blood is pumped into the right ventricle, so this is deoxygenated blood. So deoxygenated blood needs to be oxygenated. Thus, the destination of the blood from the right ventricle is exclusively the lungs. So the lungs uh, will receive blood from this artery which leaves the heart. So that artery for the lungs is the pulmonary artery. Okay, so looking at the right ventricle from the outside, so the beginnings of that pulmonary artery is also triangular in appearance. So it's a sort of cone, a conical pouch in the superior right ventricle. So that used to be the conus arteriosus in the fetus. So just like the sinus venosus was incorporated into the right atrium, the fetal conus arteriosus has been incorporated into the right ventricle. So the valve between the right ventricle and the pulmonary artery is now called the pulmonary valve. So for simplicity. Okay, so more about the right ventricle. This is what you see when you open up the rib cage of a person or a cadaver and the heart is looking straight at you. That's the sternocostal surface of the heart, which is comprised mainly by your right ventricle. So comparing the right ventricle with the left side, they are both the same size, the same volume capacity, which is about 85 milliliters of blood. But since its only target are the lungs and nothing else, it doesn't need to do as much work as the left side of the heart. Thus, the myocardium here is thinner comparatively, to the left ventricle. Since we are looking at a muscular wall and then a smooth part, which was a former fetal vessel, very similar to the right atrium. So you see a rough portion and a smooth portion when looking at the walls for the very first time. So if you look at it this way, it's a chamber where you have an entry point and an exit point. So the entry point was the right atrioventricular orifice, and the exit point is the outlet, which is the conus arteriosus, which leads to your pulmonary artery and pulmonary trunk. And then the part of the right ventricle that contributes to what we call the apex, so the apical portion. Now, as I mentioned, just showing you here the right atrioventricular septum, which separates the right ventricle from the right atrium. as represented by the tricuspid valve, the apical portion, and the outlet portion. So the conus, what used to be the conus arteriosus, which is now the smooth part of the right ventricle, which now has which has the pulmonary valve leading to the pulmonary artery. So this is how the right ventricle looks like when drawn in the atlas. You see the tricuspid valve there on the left side. There are muscles that pull on it. There are tendons that pull on it to open and close it. And right there up there is the pulmonary trunk with the smooth portion of the what used to be the conus arteriosus. So this one, the right ventricle has been dissected apart to show the three cusps of the tricuspid valve and the muscles that pull on it, the so-called papillary muscles. And if you look at the remainder of the wall of the right ventricle, it's quite meaty, and there are trabeculae there. So trabeculae carinae are what we call these structures, these long structures here. So the trabeculae carinae in the walls of the right ventricle. This is also seen in the left ventricle as well. So what do those papillary muscles do? As mentioned, the door must be closed. Thus, you need the tendons of these papillary muscles to pull on those cusps and close them, to shut them. So the chordae tendineae, or the tendons, arise from the apex of the right ventricle and attach to the cusps of, in this case, the tricuspid valve. So for each cusp, one muscle is assigned. Thus, for the right side, you have 3 papillary muscles in the right ventricle for each of the cusps of the tricuspid valve. So think of it as a door closer. So this makes sure that the valves don't flap backwards during the contraction of the blood and when the chamber is shut. So it keeps it in place. So eversion means when the AV valves flap backwards into the right atrium when the ventricles contract, and this prevents the backflow of the blood. So once the blood has left the right side of the heart into the pulmonary circulation, this is where the venous blood gets oxygenated in the alveoli of the lungs, and then they are drained back by the pulmonary veins to the left side of the heart, now represented here by the left atrium. So just like the right atrium receives blood from the SVC and the IVC, the left atrium receives blood from the pulmonary veins, which are already oxygenated by the lungs. So for each pulmonary vein, there will be orifices in the walls of the left atrium. So 4 pulmonary veins compared to 2 pulmonary arteries. And the major orifice that we see here is the atrioventricular orifice going from the left atrium into the left ventricle. So whereas the right atrioventricular orifice had 3 cusps, the left atrioventricular orifice has 2 cusps. So it's bicuspid, or it's also known, or better known as the mitral valve. Similar because it looks similar to the hat of the bishops. So in terms of naming, technically the left atrium is not left, it's mainly posterior atrium, whereas the right atrium is actually anterior because of the twisting of the heart during development. Next, the left ventricle. So the left ventricle does a lot more work compared to the right ventricle because it supplies blood to the entire body. So well, overall the chamber size is the same, but the muscles are thicker here on the left side because of the work. So the outline of the left side of the heart is mainly from the left ventricle and contributes to the apex, just as the right ventricle contributes to the apex. So here we have a cut section of the left ventricle with a bit of the right ventricle up there. Same structure, you have tendons connecting to the cusps, and you have muscles there, and you have a very meaty looking wall. So this is just a cast, just to demonstrate the twisting and turning of the exit points of the ventricles. So they're intertwined in such a way that the aorta is actually more to the right of the pulmonary artery. So the aorta is closer to the right atrium, whereas the pulmonary artery is closer to the left atrium. So as mentioned earlier, the chordae tendineae of the two papillary muscles will connect to the two cusps of the mitral valve. Alright, so the counterpart of the trunk, or the conus arteriosus or infundibulum on the right side is the aortic vestibule, which leads to the aorta. Now the aorta has its own valve leaving the heart. So it has smooth fibrous walls here, which would lead to the ascending aorta. And just as the right atrioventricular valve has three cusps, the same is seen here in the aorta. So the aortic vestibule guarded by the aortic orifice is guarded by three semilunar cusps, so similar to half moon cusps. And above each one, as mentioned, a sinus stands for a space. Above each cusp is an aortic sinus. Now, what's the importance of this? Since these are now oxygenated blood, so the heart itself needs a lot of blood. So there will be two arteries exiting these sinuses to supply the heart. So you have the right coronary artery coming from the orifice from the right aortic sinus, and you have the left coronary artery supplying the left side of the heart, coming out above from the out of above the left aortic sinus. Whereas the third sinus does not have any orifice, but has something equally important. So other than the blood supply, we need electrical supply. Right? So this just demonstrates the right coronary and the left coronary artery leaving their respective aortic sinuses. Whereas that third aortic sinus is closer to the wall because it contains one of the major conducting system nerves. So you have here the atrioventricular node, which I'll be discussing later, and the bundles that will split to supply the left and the right heart. So when we're talking about anatomy, so the dividers of the heart is important because you do not want mixing of the venous blood with the oxygenated blood. So you need septa or septum walls. So as mentioned, the wall between the right and the left atrium has a remnant of a hole there before the fossa ovalis, which in some people may persist as an opening known as a patent or foramen ovale. There may be other walls which should have closed, holes which should have closed instead of walls. So you can have what we call defects in the atrial septal wall or septum. So these are atrial septal defects or ASDs. So these are only important if the pressure on the right side of the heart is greater than the left side of the heart. meaning the venous blood would mix with the oxygenated blood on the left side of the heart. Equally important is the septum between the right and the left ventricle. Also, for the same reasons, you do not want mixing of the venous deoxygenated blood with the oxygenated blood coming from the lungs.